There are very few contraindications to patients using Roaccutane. After appropriate consultation with the doctor, we would make a decision about if it's an appropriate treatment for the patient. There are other treatments for acne which may be more appropriate to start with. However, Roaccutane is an incredibly effective treatment if it's used appropriately. The only real contraindication is for women who are planning to get pregnant or are already pregnant. Precautions for females are to be taking contraception at least a month prior to starting Roaccutane treatment and for 3 months after finishing the course. In terms of general health, alcohol is generally advised not to be taken on a regular basis. Roaccutane interferes with a pregnancy and can cause either miscarriage or teratogenicity, which is where the pregnancy can become malformed, which is why it's so important to make sure our patients do not get pregnant whilst taking Roaccutane. The typical course for Roaccutane is 4 to 6 months, depending on the severity and the improvement from Roaccutane. There is a potential risk for the liver to become strained from Roaccutane. Also, the cholesterol levels can potentially rise as well. So we do blood tests prior to commencing the Roaccutane and blood tests to approximately 2 months afterwards to make sure that the liver and the cholesterol levels are much the same. We will do the appropriate consultation, and if we think it's appropriate to commence Roaccutane and there are no contraindications, then we would proceed with the treatment if you're happy. We've noticed side effects from Roaccutane are very much dose dependent. The commoner side effects include dryness of the skin, the eyes, and swelling of the lips. Some people with the higher doses can get muscle aches and pains, tiredness, and some joint aches and pains as well. There is a very, very low risk of mood changes, but there have been some documented reports of this. But the commoner side effects are the more skin-related effects, and we recommend moisturizers, lip balm, and eye drops to help with those side effects. For females, we would need to do a monthly review to firstly check for pregnancy and then to do the repeat prescriptions. With males, we do less frequent monitoring, and initially we would see them after 2 months, and depending on their response, then perhaps another 2 or 3 times. But if there are any problems, then we would certainly call our patients back for appropriate reviews. Potentially it can make it worse, especially in the first few weeks. It can be quite common to have a flare-up of the acne. But if you bear with the treatment and carry on taking the medications, then after 6 to 8 weeks you should start noticing a vast improvement. Roaccutane really needs to be prescribed under medical supervision because of the potential liver problems that it can cause. If you buy it online, you never know really what you're getting and the actual dose itself. Therefore, it is a lot safer to have it under medical supervision. Results from Roaccutane can be permanent, and in a large majority of patients, they are permanent. However, in some more severe cases, and especially with some of our younger patients, unfortunately the acne can come back in either a more severe form or in a milder form which can be treated with topical treatments. However, there is nothing to say that you can't have a repeat course of Roaccutane again. After the first appointment, we would request you have the blood tests, and for females, we require a consent form to be filled out. Once the blood tests are back and they're all normal, then we would be happy to provide you with a prescription, and you can start the Roaccutane at that point.